Okay, I am excited to talk to our next guest. Elaina George is a physician, an MD, an ear, nose, and throat physician, otolaryngologist, as they say, from Princeton University. She's written a book called Big Medicine, The Cost of Corporate Control and How Doctors and Patients Working Together Can Rebuild a Better System. So I see two parts there. I see the cost of corporate control, and then I see part two, how doctors and patients working together can rebuild a better system. And those are two separate ideas that I want to talk about with Dr. Elaina George. Welcome to the bright side, Dr. George.
Thank you so much for having me on.
Thank you for wanting to be on. So I love the title of the book, first of all, Big Medicine, because we always hear about big pharma, but we don't really hear a lot about big medicine, right?
No, we don't, and they're all integrated. There's been an absolute shift in what medicine is now. It used to be patient-centered, doctor-patient relationship was the key. That's been shifted to corporate interests, and we're all suffering because of it.
Isn't it interesting how when you go to these HMO places, how the doctor's not there for us anymore? It's been shifted. The doctor's, he works for Kaiser now.
Absolutely right.
Right?
An independent doctor has a fiduciary responsibility and an accountability to the patient. When they become employees of hospitals and these systems, they're answering to the board and to the corporate drivers of the healthcare. It's a process.
That's a very underappreciated shift, but a very, very important shift. That your doctor is no longer working for you. He's working for a corporation who legally, like you say, doctor, is a fiduciary obligation. Legally, they have to be concerned with the bottom line, right? There's a fiduciary obligation to honor the bottom line.
It actually comes down to algorithms at this point. If doctors don't follow what is driven by the electronic medical record, they can't even close the chart. And if you keep going outside of it, you become a disruptive doctor, and you're on the hook for sham peer review, which they can remove you from the hospital setting. You may never practice again.
You know, that is unbelievable. And here's the thing, Dr. George. There's some docs who are, as time moves on, younger and younger doctors graduate and older doctors leave. And eventually there's a shifting over into a citizenry, a doctor citizenry or a doctor population, if you will, that doesn't know any different. That doesn't even remember a time when the doctor, worked for the patient. It was an independent doctor. Went to the doctor's office, and it was a real office, his own office, or even house calls. More and more doctors have forgotten that, and that's how that happens in a lot of venues. But in the medical venue, there's a lot of young doctors who don't know any different than Kaiser and HMOs. Correct?
You make an excellent point. There's been a change in the medical education. The Hippocratic Oath itself has actually changed. When I took mine, I was not allowed to still am, because it matters to me, not allowed to do any harm. I have to be an advocate for my patient. I can't, cause euthanasia. I can't perform abortions. That's the oath I took. The new one is completely different.
They modernized it?
That's correct. And they actually allow people to perform euthanasia in the new Hippocratic Oath. So it's completely opposite to what people actually think. And that's a tragedy.
They edited. I didn't know this. They edited the Hippocratic. Oh my God! Is nothing sacred?
No. If you read my book, it's actually. I give you an example of the old Hippocratic Oath, the classic one, and the new one that's taken.
I'm looking at your book right now. I thought doctors weren't. They didn't take the Hippocratic Oath any longer.
Well, I did, and it's pretty much a UN version of it. So it's globalized.
Did they change a lot of people don't realize, but it says I will do no useless. I'm going by memory here. I will do no useless surgery, and I will prescribe no poison. Right?
That's correct.
That's part of the Hippocratic Oath.
That's correct.
Did they leave that in there?
Well, it's kind of a neurolinguistic version of it. So, apply for the benefit of the sick all measures that are required, avoiding the twin traps of over-treatment and therapeutic nihilism, whatever that means.
They use the word therapeutic nihilism?
Yeah.
How interesting is that? Like everything's useless? What? Like we can't? What does nihilism mean? There's nothing. It's not worth doing anything. How do you have therapeutic? It's an oxymoron, no?
I agree with you. That's why it's nonsense. It allows people to actually talk about end-of-life decisions instead of actually trying to help the patient and pushing people into a hospice track. I mean, it's not about health care. The Affordable Care Act was about control.
Absolutely.
Control of 1/6 of the economy, control of patient choices. I mean, I'm all about individuality and independence. And if people choose a natural method of treatment, I'm all for that. But in this system, it's being negated and it's being demonized, and they are systematically removing doctors who actually want to help people, who actually want to get them better. It's all about giving you a drug at this point and putting you on a track. And if you're too expensive, make you comfortable.
How about the idea of co-opting the alternative strategies with, for example, I'm thinking about there's these essential fatty acid drugs. Have you heard about these? This thing called CoreGuard, which is like fish oil, but it's a prescription and costs you $100 a bottle.
Yeah. Well, it's actually a scam by the pharmaceutical industry, isn't it? They take what's natural, they make it somehow, they try to co-opt it, make it, trademark it,
they patent it. Yeah.
And
put a little ester on it or something.
Cost you 10 times more. I agree.
How do you like that?
Yeah, I don't. And that's the problem. And more doctors actually need to speak up about that.
Now, are you seeing patients, Dr. George, or are you, at this point, a troublemaker? I'm saying that in a kind way. I see patients. I'm actually talking with you now in my lunch hour. I love what I do. I'm a doctor. I see patients every day. And I'm proud to say I'm an independent doctor. I'm not on the payroll of any hospital. I take care of my own patients. And my responsibility is to follow the Hippocratic Oath. And that's why I wrote the book. I wanted people to understand, finally, from a doctor's perspective who practice, why it broke, who are the players who broke it, and more importantly, how you get around this system. Now, I have a lot of friends who are physicians. I've been a pharmacist for 30 years. So, for the most part, the individuals who are physicians are good people. They want to help. They want to make a difference. And I'm somewhat guilty of beating up on the profession. I don't know if, you probably listen to my program a little bit. So, I'm kind of guilty of it. And I know doctors are demonized in a certain part of the alternative marketplace, if you will. How do you feel about that as a physician? Are you embarrassed, or do you want to, what's your take on it as a physician, as a member of this kind of profession that has done so much, has misled people, even though the individuals are kind, as the profession that has misled people so much? How do you feel about that personally?
Well, I personally think it's been hijacked by corporate interests, and I think that our AMA has sold a bill of goods to doctors and patients, and they don't work for us anymore. They're actually in bed with the corporate interests. That's what the coding system's all about. That's what demonizing supplements are all about. And, there's lots of ways to treat patients. I think that we should be given the freedom as physicians and patients to choose what's best for us instead of some, big brother telling us you can only do it this way. And if it's better, if it's not part of the system, we can't make money on you, then we're going to demonize it. I'm smart enough to know the difference. And I think there's a growing number of doctors who think that way, too.
Dr. George, we've got to take a break. When we come back, I want to talk to you about the second part of your subtitle, How Doctors and Patients Working Together Can Rebuild a Better System. We're talking to Dr. Elaina George. Her book is Big Medicine. We'll be back on the bright side right after this. Don't go away. Doc, before I forget, give out your website real quick, and how can people get a hold of you if they want to talk to you more or get more information about what you're talking about?
You can go to drelainageorge.com. That's ELAINA, George like the man's name.com. I've been writing about this for about 4 years or 5 years now, so there are also blogs and some links that I think people will find really helpful.
What is your blog website?
It's the same thing, drelainageorge.com.
Oh, okay, got it. drelainageorge.com. So everything's on drelainageorge.com.
That's correct, even how to get the book.
Okay, good deal. All right, so the second, your subtitle is The Cost of Corporate Control and How Doctors and Patients Working Together Can Rebuild a Better System. So I want to talk about that second part because it's very interesting. I find the idea that doctors and patients can work together very intriguing, and I want to get to that. But before we do, you talk about rationing, this idea of rationing, and I don't think people really understand what that means and the implications of that. And then you mention socialized medicine. And then you link them to Obamacare. So I'd like you to take just a moment and talk about the problem of rationing and what that really is and the implications of rationing, and then what exactly you mean when you say socialized medicine and how these two things are connected to the so-called Affordable Care Act or Obamacare.
Well, rationing comes in two sections, if you want to put it that way. There's the insurance company's view of rationing, where they want you to pay a premium and then deny you care after the fact. They've been masterful at doing that, and they've doubled down on that in the Affordable Care Act. Then there's the soft side of it, and that's patients self-rationing because they don't have enough money to actually come to the physician or actually get the services they need because their out-of-pocket costs are so high. When I opened my practice in 2001, people would, if they had insurance, paid nothing. They just, present their card and it was all covered. They're now coming in having to pay upwards of $10,000 out of pocket before the insurance kicks in the first dime. Mind you, they're paying their premiums right along, $12,000, $25,000 for a family, and then they're on the hook for up to $10,000 more. They don't tell you this, and ultimately, people were hoodwinked into thinking that having health insurance equals access to quality health care. I can tell you that it's not equal. You can carry a piece of plastic, but it doesn't mean you're going to be able to see a doctor. And if you do see one that works for you instead of against you. Doctors are now agents of the government in this new system. The Affordable Care Act has something called meaningful use, where we're forced, if we choose to, take Medicare, forced to ask questions like, do you have a gun in your home? Have you ever tried to hurt yourself? How many people live at home? Pediatricians have to ask if your child thinks he's a boy or a girl. Let me tell you, this is a metadata system. They are gathering your data for population-based medicine. And there is no...
Wait. Hang on, Dr. George. Population-based medicine? What do you mean by
correct.
That sounds...
That means they're looking at sickness amongst populations, black people, women, children. They're trying to drive or get information about each of us as an individual. For example, if I write a prescription for somebody to help them stop smoking, and it's an antidepressant, I'm not using it because they're depressed. I'm using it because I want to help them stop the craving. All the system sees is that they're on an antidepressant. And let me tell you, it goes through the entire system. HHS looks at it. FBI looks at it. And my personal feeling is that there's nothing to stop them. If you want to get a legal handgun or get a government job from saying, hey, you've had an antidepressant in your background, you must be unstable. This is the system that we're going into. It's not personalized at all. And you just become a data gathering source, and they're going to apply whatever they believe about you to you, whether it's true or not.
So the Leviathan was hiding inside the Trojan horse of the Affordable Health Care Act, and then it jumped. We let him into the city, and he jumps out, and it's really all a data grab.
No question. It's not about health care, because if they really wanted to get you better, they wouldn't be cutting off medications. For example, Medicare no longer covers Avastin for uterine cancer because it doesn't help that many people, and it's too expensive. Everybody's now a cost center. And they pay doctors now to talk about end-of-life decisions, but not to give you the medical care you need to get you better. It's outrageous.
Now, I'm going to ask you a quick question, and this is just personal. I don't know if you'll have an answer to it, but just your personal opinion. Do you think Obama knew about this? As a person, do you think he was aware that this was what this was about when he was proselytizing and using the bully pulpit to kind of push this thing? Do you think he personally knew about it? I know you don't know for sure. What's your take?
Well, my take on it is nobody read the bill, but I think that they wanted this chaos because.
But him personally, him personally.
I think no. But he thought that he's in bed with single payer. He wants that, and that's what the whole system is moving towards. So obviously he didn't write the bill. Neither did the Congress. It was the pharmaceutical industry, medical insurance industry. The unions were involved. Hospital corporations were involved.
They wrote the bill. They wrote the bill.
Absolutely. It's a lobby-driven bill, and it's full of pork and cronyism for these particular corporate interests. There were no doctors in there that practiced medicine. There were no patients involved. We're the last on the list. All we do is drive the system. We as doctors, we help help the system charge because we order the tests and we order the prescriptions. But they don't like us very much. They want us to shut up and just keep ordering. And patients don't get sick.
All right, so here's the deal. Program's the bright side. We know the bad news, and it's important that we tell people the bad news, and we don't shut up about this. But what's the good news? Second part of your subtitle, how doctors and patients working together can rebuild a better system. What's your take? What's your vision?
The first thing that people need to understand is they need to find an independent doctor who is not in this system. There are growing numbers of doctors out there who practice medicine using Hippocratic Oath. And if you go to a website called aapsonline.org.
Let's say that again. AAPS.
AAPSonline.org.
What is AAPS?
It's an Association of American Physicians and Surgeons. These are independent doctors who join together. They're the anti-AMA, if you want to put it that way.
Oh, wow.
And we have doctors who specialize in practicing medicine, again, using Hippocratic Oath. There's sliding scale, so if you don't have insurance, we make it affordable. There's direct primary care.
Wow.
There's a subscription model where you can pay. I give myself as an example. $65 a month in my ear, nose, and throat practice, if people join my membership, will cover any ENT service I offer, hearing tests, allergy testing, endoscopic examination for that $65 a month. That's reasonable. And if I cut the middleman out, I can stop doing all these stupid regulations and nothing but nonsense that jacks up the price. That's going on across the country. And there's another little pearl that people don't know about called medical cost sharing. It's written into the Affordable Care Act, but nobody ever talks about it. What it is a consortium of self-pay patients who join together, cover their own health care expenses, and they're parallel to the system. They're able to access the real cost of health care, which are about a third of what people are paying now. And I joined, and I put my office staff on it because I personally cannot deal with the insurance industry. So I'm having the most expensive policy, which is $199 a month. I pay a total of $500 out of pocket per year, and I'm covered up to $1 million per occurrence per year, and I can go to any doctor, any hospital that I want. And I also get benefits for holistic care as well. So if I want to do Qigong or Reiki or whatever I choose to do, it's covered. That's the alternative that exists now. Patients need to know that it exists so they can make an informed choice, and that's what the book teaches people.
Now, tell me about this insurance program again, or tell the listeners how they, because I'm sure a lot of people are going to be interested in this.
It's called Liberty Health Share, and if people go to libertyoncall.org, they can learn all about it. It's not new. It's been around for about 18 years, but it was a small organization, but it morphed into a more inclusive, anybody who's liberty-minded, anybody who wants to take responsibility for their own health and will voluntarily cover somebody else's, their members' healthcare needs.
And this is all on your website?
It's all on the website, so is the link. But it's the future, and it's actually your choice that you don't have to do the Affordable Care Act if you don't want to. You don't have to go to Aetna or Cigna or any of these other insurance companies because, trust me, they're becoming too big to fail. And the more power they get, the more they charge you, the less they pay the physician, the worse the care is going to be.
Wow, Dr. George, you are doing some super, super work. I can't tell you how grateful I am as a fellow healthcare professional for what you're doing. Just awesome stuff. The book is Big Medicine, Dr. Elaina George, and then it's drElainageorge.com, drElainageorge.com. Check out our blog and check out our website. And also Liberty Health, that's really cool information, libertyoncall.org, and then also the Association of American Physicians and Surgeons, aapsonline.org. Thank you so much, Dr. George. Have a great day.
Me.
Good to talk to you.
You too.
Okay.
Bye-bye.
Okay, bye-bye. Yeah, that's libertyonline.org. I highly suggest you check them out if you don't want to be dealing with Obamacare. And then also aapsonline.org, and that's the Association of American Physicians and Surgeons. Check out Dr. George's website. All this information is up there, plus her blog, drElainageorge.com. All right, that's all the time we have for today. I'm Pharmacist Ben. Have yourselves a spectacular, awesome day. We'll talk to y'all later, folks. Bye.